Hi, I'm Debbie, and I am a Zejula Patient Ambassador. You know, I always kind of like to stretch the envelope on things to do, and I don't know if that's because I did grow up in a small town, so, you do have sort of limited entertainment there. My husband Rod and I have been married for 40 years, and we have two amazing sons, Nicholas and Casey. We have just, as a family, always liked to do active things that are just a little bit outside the norm. After the boys left home, went to college and left home, we picked up some new activities. We started motorcycle riding, we started four-wheeling, we started things like target shooting. We just like to get out and do as many active things as we can. I really didn't have any symptoms for ovarian cancer that could be actually really immediately recognized as ovarian cancer. What I did have, though, was something a little bit different. I had a sensation that this tightness in my leg was moving, and I thought, well, this is just really strange. We went to a hospital and to an ER and said, this leg just is, there's something going on with it. So they then did scans and found blood clots in my legs. They reassured me, they told me I'm all healthy. By Sunday of that week, though, we were making rolls and I noticed that I was having some real pain in my abdomen. Later that night, we decided maybe we should have it checked out again. So we went to the hospital again. They ultimately ended up doing a CT scan, and the CT scan came back abnormal. The emergency room doctor came in and said, "We believe that what you have is ovarian cancer." I guess the first thing in my mind was, how am I going to tell people who love me about this? This was going to be bad news. I was scheduled for the following Tuesday for a debulking surgery. I met with a local oncologist about 6 weeks after my surgery and was told that I would need to do chemo. Although I was losing my hair and although I was going to chemo, I just tried to look for the best in everything, and I tried to just make it as something that I could get through.
When Debbie was first diagnosed, I felt devastation pretty much for the first part. Didn't know which way to turn. She was a trooper for the chemo. The doctor said one day, he says, "I don't know how you can do all that stuff, everything hits you. You haven't had anything good happen to you in 8 months."
So I finished chemo and actually jumped right back into life. Stopped working part-time, stopped working from home, and resumed full-time. Everything was pretty good, and I felt really good. I felt good about everything. My hair actually started to come back, so that was a plus. It was really kind of just a return to life. I don't know, at about 10 and a half months, somewhere in there, I just started noticing some subtle changes. Nothing serious, just different. So I contacted my medical oncologist who said, "You know what, you're fine. Until you are completely symptomatic, I want to take a watch and see approach." I kind of decided that given that he wasn't going to be any help to me, I would just try to take matters into my own hands a little bit more. Went back to my OBGYN and I said to her, "Here's what I want. I want a CT scan. I want a CA-125. I think there's something wrong." The next day her office called and said, "Deb, we need you to come to the office this morning." Rod and I went to her office, and yes, it was back. Yes, my CA-125 was up, and yes, they found 4 separate spots on the CT scan. So we knew it was back. I would be doing surgery again, and I would be doing chemo again. So I kind of felt like I knew the ropes a little bit, so I knew what to expect, and there was some comfort in that. They got a gynecological oncologist to do the surgery who was an absolute fabulous surgeon, fabulous man. I kind of credit him with saving my life. I was interested in being on a clinical trial from the very beginning. I had talked about being on a clinical trial with my first medical oncologist, and he told me absolutely not, he doesn't do clinical trials. When I went to a different medical facility and got a new medical oncologist, again, that was one of the first things out of my mouth. I would just really like to be on a trial. Shortly thereafter, he came up with what he said was the perfect trial for me. He said he couldn't shake the feeling that this trial was tailor-made for me. So he said it was for something new. It was a phase 3 study, and it was for something new called niraparib. Niraparib was a PARP inhibitor, which he felt was specifically really good for me. I started the niraparib at 300 milligrams a day, which was the recommended dosage. I found very quickly, though, that that was not going to work very well for me. My platelets were really very, very low. So, of course, I had to stop the niraparib. I stopped for 2 weeks to let my platelets recover, and we continued then at 200 milligrams a day. And at that dosage, my CA-125 came down a lot, and it has been steady for the most part ever since. Currently, I'm at 100 milligrams per day. After I started that clinical trial, the FDA actually approved that niraparib, so it is now known as Zejula.
Yeah, we have a bucket list that we want to try to get through all of them as soon as we can. She wants to go still down to New Orleans. There's a show about pit bulls, and they take volunteers, and she wants to go down and take the camper, and I think we have plans to go to Europe still. My advice as a caregiver is to stay strong and just be as supportive as you can. Be patient, just do whatever you have to do.
I was honored to be chosen as a Zejula patient ambassador earlier this year. If it's true that there is good to come out of everything bad, being an ambassador might be the good that's come from my having been diagnosed with ovarian cancer. I've now been a survivor, and I would hope that the rest of my life lasts many, many years still. My hopes and goals for the future are just to live large each day, to make each day count, and I'd like to have several more days. I'd like to have a lot of more days, but I think it's what you put in those days that's really counting.
Important safety information. Zejula may cause serious side effects, including bone marrow problems called myelodysplastic syndrome, MDS, or a type of blood cancer called acute myeloid leukemia, AML. Some people who have ovarian cancer and who have received previous treatment with chemotherapy or certain other medicines for their cancer have developed MDS or AML during treatment with Zejula. MDS or AML may lead to death. Symptoms of low blood cell counts, low red blood cells, low white blood cells, and low platelets are common during treatment with Zejula. But they can be a sign of serious bone marrow problems, including MDS or AML. These symptoms may include the following: weakness, feeling tired, weight loss, frequent infections, fever, shortness of breath, blood in urine or stool, bruising or bleeding more easily. Your doctor will do blood tests to check your blood cell counts before treatment with Zejula. You will be tested weekly for the first month of treatment with Zejula, monthly for the next 11 months of treatment, and from time to time afterward. High blood pressure is common during treatment with Zejula, and it can become serious. Your doctor will check your blood pressure and heart rate monthly for the first year during your treatment with Zejula, and as needed afterward. Your doctor may lower the dose of Zejula to treat high blood pressure. Before starting to take Zejula, tell your doctor about all of your medical conditions, including if you have heart problems, have high blood pressure, are pregnant, or plan to become pregnant. Zejula may harm an unborn baby and may cause loss of pregnancy, miscarriage. If you are able to become pregnant, you should use effective birth control, contraception, during treatment with Zejula and for 6 months after taking the last dose of Zejula. If you are able to become pregnant, your doctor may perform a pregnancy test before you start treatment with Zejula. You should tell your doctor right away if you become pregnant, are breastfeeding or plan to breastfeed. Zejula may harm your baby. You should not breastfeed your baby during treatment with Zejula and for 1 month after taking the last dose of Zejula. Tell your doctor about all the medicines you take. including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Zejula include the following: heart not beating regularly, nausea, constipation, vomiting, pain in the stomach area, mouth sores, diarrhea, indigestion or heartburn, dry mouth, tiredness, loss of appetite, urinary tract infection, shortness of breath, cough, rash, change in liver function blood tests, pain in your joints, muscles, and back, headache, dizziness, change in the way food tastes, trouble sleeping, anxiety, sore throat. If you have certain side effects, then your doctor may change your dose of Zejula, temporarily stop your treatment with Zejula, or permanently stop treatment with Zejula. These are not all the possible side effects of Zejula. For more information, ask your doctor or pharmacist. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information.